demanded. But if the change happens because of your deep understanding, your interaction with each other, then something happens. And it's not just with, I have many friends now who have children, and I can remember one friend in particular. And he had the advantage, or disadvantage, but advantage of being rich. And so he didn't have to work for money. And he'd just drive around worried because his wife wanted a kid. And it was like, you know what? I think if I have a kid, that might change me. And I don't know, he's 26, 27 years old. It's like, I like hanging out at night. I like going to bars. And if I have a kid, my wife might want me to be at home with her and the kid. Eventually, he did have a kid. Now he has 2 kids. And he became such a doting father. It's like every time you see him, look at these pictures, look at these pictures. Ooh, see, my son is standing. My son took his first step. And it was nice, but after a while I got to be a little tedious. It's like, this is the 2nd step. This is the 3rd step. It's like he changed. And he changed in ways he could not have anticipated. But he actually loved the change. He's my age, and he's still a good friend. His kids are grown now. And he said the most important thing in his life has been being a father and a husband. But he didn't anticipate that. He couldn't have sort of appreciated that when he was thinking, the most important thing in my life is to be able to go to a bar and get drunk. So yes, we're going to change, but can that change come from a space of understanding and love? And belonging actually invites us into that space. And so that's one of the things that's happening in the world today, is that people are, yes, migration. There are between 300 and 400 million people who live outside of their birth country. And that number is going to increase. How do we think about that? How do we deal with that? The way we dealt with in the United States early on is we said, okay, if you're Native American, your space is over there. We're going to call it a reservation. Stay there. And if we want to integrate you into our society, we're going to do it by saying, we don't want you to speak your language. We don't want your children to go to school to learn about their culture. We want them to learn about our culture. And again, for Native Americans, that was devastating, and it's still devastating, because it was forced. And so part of the thing is, can we move beyond that? And a lot of the social determinants of health actually come from that, from saying to people that who you are is not good enough. And so can we actually imagine something different? And belonging connotes something very deep at a structural level. And it's not just about where we are, it's even how we stand up and how we show up in stories. Whose story is it? Am I just a trope in a story? So when I was a kid, and I used to watch television or movies or whatever, there were very few black people in the movie, very few. And if they were, they never made it past the credits. It's like the first 10 minutes of the movie, they'd be dead. And you can't imagine how wonderful it was when I saw a black person to sort of survive all the way to the end of the movie. And we're still struggling with these issues. There actually were people organized, and I still go to the movies, so I don't go as much as I used to. But there are still people organized because they're threatened by the change of having other people come in the movie. So, how many of you, if any of you, saw the movie Wonder Woman? Okay. Did you like it? Okay, some of you liked it. Here, there was an organized attempt to boycott Wonder Woman, and the argument was, and even more so, the newer movie, Captain Marvel, starring a woman, because it was like, ooh, women in a role as superheroes? And where's the husband? We don't want, when John Wayne was around, no one said, where's the wife? In all these cowboy movies. But the role of women was, like the role of black people, it's like, you're just there to serve the man. That's your job. You're not supposed to be strong. You're not supposed to be on your own. You're not supposed to be making decisions. And so even those little things are constantly being renegotiated. So how we show up in stories, and how we show up in stories in part is affected by who writes the story. So the speaker earlier said, if you're not at the table, you're on the menu. I don't want to be on the menu. I want to help develop the menu. And not just for me to develop the menu or you to develop. Can we develop the menu? Can we actually come together and share, have a story where we all show up and we all can be superheroes? So this is what belonging is about. It's actually having supporting structures, stories, and policies where you're visible, where you show up in statistics, where you show up in the policies. So one of the things that the ACA is doing, and we're working with Liz and others, it's been wonderful. It's like turn to the community and say, what is it that's important to you? We've done research in communities around the country, and we like to have some consistent research so we can make comparisons. But we go to some places and we say, what research do you want done? And we were working in one community in Minnesota, and they said, we want to know where the liquor stores are. That never crossed our mind. But it turned out that was actually quite important, because where the liquor stores are, it turned out, and I don't know how this happened, the liquor stores were close to the daycare centers. And I know my daughter's here, and good friends, and being a parent and being a child can be stressful. I was getting off the plane coming here, and there was a mother and 3 children, and apparently one of the children had left a backpack on the plane, and the mother was scolding the child. Said, you only had one responsibility in this trip. You just had one, and you blew it. And as we're getting off the plane, all the adults would say, ooh, I remember that. I'm glad I'm not a child anymore. So yes, being a child and being a parent and being a husband, being a wife, being a human can be stressful. But to deal with that stress by saying, okay, before I pick up my child, I want to stop at the liquor store. So the liquor stores were close to the daycare centers. That's like, who thought of that? And it turns out it had a lot of negative implications as well. So part of belonging is for people to participate. And now we have this participatory research where people who are the subject of the research can participate in the design of the research. Seems logical, but it took us a long time to get there. But this is about belonging. And when we don't belong, it actually shows up not just in stories, but also in the way we organize structures, the way we organize resources. So we're all situated in structures, but we're not situated in structures evenly. We're not situated in structures in the same way. And I'll talk more about that this afternoon. And now with the help of the outstanding AVA people, we're going to show you a video. We can start it over. We have of all the forces shaping politics and power around the world, perhaps none are more important than our sense of who we are and who we are becoming. We are in a period of accelerated change in at least 4 areas: globalization, technology, the environment, and demographic change. We can only process so much change in a short period of time without experiencing anxiety, which is a normal biological reaction. But how we respond to this anxiety is social. Our response is greatly shaped by the stories presented by leadership and through culture. These stories speak to our deepest values and our core beliefs about who we are, many of which operate at the subconscious level. We can respond to these changes either as a threat or as an opportunity.
The first response is breaking. The second is bridging. Breaking can create a deep fear of other groups, making it easier to accept false stories of us versus them. Breaking perpetuates isolation, hardens racism, and builds oppressive systems, while driving our politics and institutions toward anti-democratic and inhumane practices. The other response is bridging, which calls on us to imagine a larger, more inclusive league. When we bridge, we see demographic change and our diverse identities as positive and enhancing who we are. Bridging calls on us to engage in healthy dialogue and requires us to listen deeply. Bridging does not mean abandoning your identity. Bridging means acknowledging our shared humanity, rejecting that there is a them, and moving toward a future where there is instead a new us. But when we bridge, we not only open up to others, we also open up to changes within ourselves, or we can participate in creating a society built on belonging.
So that's the goal, to build a society based on belonging. And it's not an easy thing. It's easy to say, but it's hard to do. But also want to acknowledge that, yes, when people are nervous about the changes, again, that's natural. We can only process so much change in a short period of time without feeling anxious. But then what we do with that is social. We can actually, as people, as healthcare workers, we can actually figure out a way to say, this is who I am, but I can connect to you. And so part of what belonging requires is bridging. Bridging is basically engaging in empathetic listening and empathetic practice. Let me hear your story. Talk to me about your suffering. It doesn't mean I agree with it. It doesn't mean it's my story, although it may be connected to it. But I need to actually listen to your story. And that's especially true in the area of health. I lived in India for a while, and I came back with a serious disease. And it was about a year when I was going around to doctors, and they couldn't diagnose the disease. And so they kept telling me, well, maybe you're mistaken. You know, you just have all these symptoms. And literally, I would be in the doctor's office, and they would be going through their medical books, not looking at me. It's like, I don't, you say you have this problem. I don't see it in my books. And finally, I went to a doctor, and she actually said, I don't know what you have, and I don't see it in my book, but it must be really hard to be going through what you're going through. And I just started crying. And she just acknowledged that I was going through something. She wasn't trying to talk me out of being sick. And so part of people healing is to acknowledge their pain. And the pain is not just the clinical pain. The pain is being separated from their land, or separated from their children, or separated from their language, or separating from their religion. So belonging is a powerful way to actually heal. And in order to actually practice belonging, we have to practice bridging. We have to practice listening to people who don't necessarily agree with us. I mentioned that we had a conference on othering and belonging, and I'll just give you one sensitive flavor. Something just happened in Florida that was amazing. There's something called the Florida voter restoration, where they restored the vote to 1.4 million Americans who had lost their right to vote. And when you came out of prison, you still were not allowed to vote. The two people who were most involved in this process is a guy named Desmond and another guy named Neil. Now, Desmond is African American. They're both returning citizens. Spent time in prison. He lives in an urban area. He's very progressive. Neil is white. He lives in rural Florida. He's a Trump supporter and had never known any black people. And in his own imagination, black people were always the negative part of his story. These two guys came together and went around Florida, and they listened to each other. And in that process, they did something amazing. One of the things they did, and all the pundits say, you can't win this in Florida. You cannot win getting people the right to vote in Florida. And in order to win, you need more than 50% of the votes. You need 60% of the votes because it's a constitutional amendment. They won. They didn't get just 60% of the votes. They got 65% of the votes. They got 1 million more votes than either the Democrat or the Republican candidate for governor. And in the process, they're still going around together, and they're saying, it's not simply about winning the right to vote. It's not simply winning the election. It's actually seeing each other and celebrating our shared humanity. And they're an unlikely couple when you see them together. So part of it is listening to each other and finding and creating that shared humanity. And there's a very high correlation between people being heard, people belonging, and positive health outcomes. So there's two competing visions. One is this small vision of we that's afraid of everything else. And so you can decide who, and this is happening all around the world. So in India now they're saying, okay, if you're Hindu, you're part of the we, but if you're Muslim, you're not. In some part of the world they're saying your sexual orientation will decide whether or not you're part of the we. And you should be afraid of those other people. They're a threat to our way of life. The world is changing, and it's going to continue to change. But can we actually construct a story and a set of practices where we say all 8 billion people belong? And not just say it, but actually do it and practice it and live it. And I'll bet you a dime to a donut if we do that. It won't be easy, but we'll see tremendous shifts in terms of health outcomes. If we don't do that, we will actually experience what they're experiencing in England right now. They've recently created a department of isolation, a department of loneliness. That because when we keep breaking from people, when we create these smaller we's, we don't just separate from other people, we separate from aspects of ourselves as well. So we've been talking about bridging and breaking. There's one other concept, which is bonding, which is where you actually celebrate who you are, not in opposition to anyone else. So we saw this morning in terms of a beautiful celebration about Native culture. This is not necessarily saying we don't care about Latino culture, we don't care about Black culture, we don't care about white culture, but it's saying we need to actually celebrate our own culture, especially after that culture being denied for so long. So this is the challenge. It's not just happening in the United States, it's happening all over the world. And how we step into this challenge matters. If you see the map on the bottom there, bottom right, this is the amount of violence that's happening around the world in the name of white supremacy. And what people are claiming, and we just saw what happened in New Zealand, is that some people are saying, you don't belong if you're not white. You don't belong if you're not Christian. You don't belong if you're not me. And we have to counter that all over the world. And we are seeing positive examples of this. So after the violence, the deaths in New Zealand, we saw, and these people sitting outside the mosques to protect people. These are Christians. These are people who aren't, quote unquote, directly affected, but they are directly affected, but they're not Muslims. But they're saying, you are part of us, that our vision includes you. It doesn't deny you. And the Prime Minister of New Zealand talked about bridging, talked about love, talked about a larger we. So we think that this is actually needed, not just in New Zealand, but all over the world. So again, you heard this morning about the social determinants of health. And sometimes when we give these talks and people say, well, why are we even talking about race? We're talking about health. What's the relationship? And I want to say the social determinants of health and the social determinants of race are the same determinants. That when we talk about race, we're not talking about someone's skin color or someone's ethnicity. We're talking about how they show up in the public imagination. Do they belong? And we see the same factors that end up having negative health outcomes are the same factors that's heavily correlated with race. Again, you're already doing that, starting to do this in terms of thinking about systems. You're dealing with a whole number of things. And it's easy to get overwhelmed because you say, well, I'm a healthcare provider. And people are not talking about housing, they're talking about homelessness, they're talking about jobs. That's not my work. And so part of the thing is, how do you actually work with others in a coordinated way so you can actually deal with the social determinant of health, not just from the clinical side, but also from the social side. So not belonging has consequences. And we see here some of the consequences. It actually have serious negative health outcomes. And unless your eyes are much better than mine, you can't read this. But what this is, and I'll make this available, is looking at some of these factors as it affects different populations. And we'll talk more about this afternoon. And in this, we're actually looking at some of the factors in terms of belonging as it relates to different communities, but particularly the Native community. And I just want to say, one of the reasons we've been doing this is here in Washington, obviously, you have a substantial Native population, but also I want to center that population here because that population has disappeared so often in terms of our research, in terms of our work, and then we're surprised that we have these negative health outcomes. So I think one of the ways you deal with that is not to ignore other groups, but to center that population. And we know that health is not the same as health care. And so again, it goes beyond what you're doing, what happens when you go to the doctor or nurse. For example, where you live matters. And we know, for example, that we can actually project health outcomes based on your zip code. But there are a lot of other mechanisms that are associated with positive and negative health outcomes, whether or not you're segregated, whether or not there's discrimination. How do you feel about yourself? Oftentimes, when we talk about othering, we're thinking about what somebody does to somebody else. But many people end up internalizing the othering, internalizing the negative message and negative story about their population. And of course, one of the ways we can measure this, and we do need to have some way of evaluating and measurement, is through a number of things. You have some listed here. There's a high correlation between inequality and negative health outcomes. The more unequal a community, the more negative the health outcomes are for everyone, not just for low-income people. Again, this is some data about Washington, looking at which populations are doing best in terms of life expectancy. And it probably won't surprise you, but the group that does best as a group are Asians. The group that does worse as a group are Native Americans. And slightly above Native Americans are African Americans. These are similar data based on where you live, on counties. And you may see your county up here. Again, I'll make this available to you. We have this concept called concentrated poverty. They also call it the neighborhood effect. So if you live in an area where poverty is very high, even if you're not poor, your life outcomes are depressed. And so, if you can imagine a real estate broker saying to someone, if you live in this neighborhood, it's a nice neighborhood, the houses are reasonable, but you're probably going to die 10 years earlier. Or you can live in this neighborhood. Where again, the houses are nice, but you're going to live much longer. And obviously, you choose the latter. But we organize it so some people cannot choose the latter. This is actually looking at, again, living in concentrated poverty and life expectancy. Correlation is incredibly strong. I only have about 4 more slides and 1 more minute. This is something called allostatic load. You probably know the concept, but it's looking at a number of biometric things together, and very heavily associated with race, with poverty, with ethnicity, with belonging. So the more likely you are not belonging, the more likely you're other, the higher your allostatic load. And it goes up, and we can measure it. For example, blacks and whites and Latinos and Native people have a different allostatic load at birth, and that difference widens over their life. Telomeres. This is the last technical term I'll use for now. Many of you in health will already know this, that the end of your cells have like a tail. And this tail is actually what allows us to actually absorb the nutrients of the cells. And we can measure it even through saliva. We can look at our telomeres. We can look at the health of any of you in the room and project the life outcomes by the length of your telomeres. And the telomeres naturally shorten as we age. So a child's telomeres are fairly long, adults' telomeres are much shorter. But telomeres are also different length based on our race and ethnicity. And telomeres are responding to stress. So stress is not just how I feel right now, it's physically changing the structure of the body. It makes the body less able to actually absorb what it needs to actually survive. And what it's responding to is the stress, the social determinants of health is actually being mapped into the body, the structure of the body. The last concept I want to leave you with is networks. So how do we actually create sort of the space, the resiliency? And resiliency is actually not an individual factor, it's actually a collective factor. So if you're in a relationship with others, a positive set of relationships, you are more resilient. If your relationships are strong, but they're problematic or stressed, then it's actually going to depress your outcomes. And I'm going to run through this, but the point I want to make, and some of you know this already, is that I was just reading before coming up, Native populations have about 3.5 times the suicide rate of their white counterparts. And what we know now is that the factors that impact suicide in the Native community are not the same factors. They're actually different expressions of phenomena. Blacks have about 5 times post-traumatic stress syndrome as their white counterparts. And what we know now is that the factors that cause that are actually different. And we could keep doing that. Obesity is a problem that's actually sweeping across the United States. But the factors that cause that in different communities are actually different. So I'm going to close again by just saying that there's a lot we can do, but we can start by engaging in a process of saying to all groups, that you belong. But not just say it in terms of words, but also say it in terms of structure, stories. The last example I'll give is that, and I'm not going to talk about this today, although it may come up in questions or in some of the breakout sessions. There's the conscious mind, which is very small. And then there's the unconscious mind that's very big. The unconscious mind actually is more closely related to the body. So sometimes someone's telling you something, and if you're very perceptive, you say, you're saying something, but you're looking to the left, which says you're probably lying. And you actually can be lying to yourself. That is, I'm saying something consciously, but the rest of my body, my unconscious, is saying, we're not down with that. This is a whole nother conversation, so I won't go into it too deeply now. But the conscious processes 40 bits of information a second. 40. And you may say, what's a bit? Well, open up your phone when I say you got so many bits of knowledge or so many bits of memory. So the conscious processes 40 bits. The unconscious processes 11 million bits a second. The unconscious learns, it's actually sometimes referred to as habituated. It learns from the environment. So the mistake that people make is that they think the unconscious is what's happened between our ears. But no, the unconscious is social. The conscious is more individual. And so when you have social representation of a group being negative, we're sending a message to the unconscious that is picking up. So we can say we care about somebody, but if all of our practices, if all our images, all of our stories are different, the unconscious picks that up. And so it has a negative reaction to that group. And so part of it is to actually figure out how to talk to the unconscious. And one of the ways we talk to the unconscious is not through facts, not through data. We need that. But actually through stories. The unconscious likes stories. So there are tons of examples of this. But if we are going to really say to people you belong, it's not saying it just in terms of words, it's saying in terms of practice, so the person can experience and the unconscious can believe it. And I like to refer to the unconscious as the lizard brain, because it's the oldest part of the brain. So sometimes when somebody says something, I say, okay, I heard what you said, but now tell it to the lizard. Convince the lizard that you really mean it. Convince the lizard that we all belong. Thank you.